Okay, spiritual people, I've been promising you help. Here comes some help. So this is going to be the first video in a series of a few. This one is just going to go over the basic spiritual care note. Okay, ready? Let me share my screen and let's get to it. Okay, and we'll start at the beginning. And how to write a spiritual care note. Let me move our facer out of the way. Get rid of this. And what I did was just went into a note, spiritual care note, opened it up, okay, and we're going to go piece by piece. So here is the beginning of the note. When you open up the note, basic information about the patient. It'll have the patient's name, their date of birth, medical record number, diagnosis, additional diagnoses. Are they a DNR? And this is where you put your time in and time out and the date. And then was it in person? And log visit count on finalization. Because if you're writing a note, that means that you did a visit and the visit should count against the visits that were ordered in the physician's orders, right? Okay. Next, the first section after that is family adaptation. And it asks some basic questions. So family, are they involved? Do they provide care? Are they involved, but not with physical care? In this case, the family was providing care. And then it asks questions about coping. Was the patient, family, and caregiver, were they coping effectively, right? Sometimes you have to ask a few questions to see if that's the case or not. In this particular case, everybody was coping very effectively. They're huge support system for this particular case, wife and daughter, right? And I wrote that in there. And then the patient and family caregiver interaction. What did that look like to you? Was it appropriate? Did it seem difficult or guarded? In this particular case, there were multiple family members there, and they were all there to support the patient. Okay. And was there any family conflict? Again, in this particular case, there wasn't any. But, in some cases, there might be, right? So you would, mark whatever was appropriate there. Okay. Now, depending on the way you answer these questions, it may generate a care plan recommendation. So here is the next slide. And it's saying family adaptation issues, right? Is there an issue? Well, I wrote here the daughter does feel overwhelmed and sad. So there is an issue with one caregiver. So I put here as the issue, the family needs emotional support with handling the patient's imminent death. Okay. I write my own care plans. There are some pre-made ones, but they're not great. So just what's the issue? What is the problem with the family adaptation? It's that the family needs support. And then I went on to explain, the family's accepting of the patient's passing, but they're expressing feelings of being overwhelmed by the speed of the disease, right? That's a problem. Well, then what are we going to do about it and how? The next section are the goals, right? And oh, by the way, right. So the issue status should be current, right? Because that means it's a current issue that we're dealing with. Then the goals. Well, what are we hoping will happen? Well, and it's got to be measurable. So I wrote as a goal, the family will verbalize feelings of calm acceptance within one visit. Okay. And you don't have to add a description. You can if you want to. You don't have to. And that should be progressing. In other words, we're progressing towards that goal. And then the third part of the care plan are the interventions. So what are we going to do to get to the goal? We're going to provide the family the opportunity to reflect on positive memories of their lives with the patient. And then as a descriptor, I put in here kind of a rationale. Life reflection allows the family to focus on all the positive interactions that were meaningful while the patient was alive and healthy, and allows the passing of the patient to be accepted as the next natural stage of life. The intervention was applied. Discipline, well, I'm writing nurse because I'm a nurse, but you would write spiritual counselor, and it's current. So there, we have one care plan. We have an issue with a goal that we hope to attain with interventions to get us to the goal. Okay? All right. Then we're going to move on to the next section, spiritual counselor. Okay. And that section asks about their current spiritual support. In this case, this guy had family, friends, church, synagogue, prayer, belonged to Beth Israel. Spiritual intervention needed. Hospice, right? Or it could be their church, synagogue. It could be both, right? It could be something more than that. It asks about their religious affiliation. Yes, Jewish practicing. And then it asks if they're practicing. And then what is their personal belief assessment? So in other words, are they devout and practicing, or have they lost faith? Do they feel hopeless or despair? Do they feel isolated, from their religion? Whatever, you would answer that. In this particular case, he was a devout patient, very, very religious with the Jewish faith. So we have care plan for spiritual issues, but there aren't any spiritual issues right now. So if there's not an issue, you don't have to write no issue. You just have to go here and click address override, because there's not an issue. There's no point in writing a care plan if there's nothing to care plan, right? So you don't need to write no issue, because you already told me that there wasn't an issue by answering the questions on the previous slide, right? So in other words, you wrote here that there's no issue. Everything's good. So if there's no issue, just click addressed override for the issue. For the goal, addressed override. And for the intervention, addressed override, because there's no care plan needed in that particular arena. Okay. Then the next part of the note goes to the bereavement section, and it asks about the bereaved. There should be a bereaved when you click this drop-down box. A name should populate. It did, but I didn't take a picture of it. I should have. But that means that if it doesn't populate a name, let me know, or let the case manager know, let somebody know, so we can get them in the relationship table. Then it asks about their risk level. Low risk. The wife's name was Carol. She's female. There's her age. She's the spouse. Did she have coping challenges? Not really. Concurrent stressors or losses? No, not really. Support system, big, huge support system. The synagogue, the family, friends, tons of support. Luckily, not all people have that, but she did. Okay. And then the next one asks about, is there a support system available? Yes. Do they have any cultural barriers? In this case, no. But say if there was a language barrier, right, that could be an issue. And does the patient have any other relatives that need support? In this case, no, but there might be, right? And then, so that's the bereavement section. So then a bereavement care plan is underneath. Do we need one? No, because there's not a bereavement issue. Everybody is low bereavement risk. Everybody's going to be adjusting, within a normal parameter. So you would just click address override for the bereavement issue. And then you would click address override for the bereavement goal and intervention, right? Because there isn't an issue. And the last section of your note is the summary. The summary, you don't have to keep rewriting the same thing over and over again. The summary is going to ask you, number one, was there teaching done? There should always be some sort of teaching done, right? Whenever you counsel somebody, you're teaching. So that should always be yes. Well, what happened? Give me a summary of the visit. The patient and the family have a devout belief system in place with the Jewish faith. This writer provided an opportunity for life reflection with the bereaved and silent but active listening for additional support. Right? That's everybody's coping well, right? And then on finalization, send the summary, and I just basically click everybody across the board so that it pulls to the IDG notes. And that's a simple note, right? It's very simple. So with the care plans, there has to be at least one care plan for the note for that patient. So when you go out and do your initial evaluation and you say, yes, I want to keep seeing this patient and or family, there's got to be a reason why, which means there's an issue, which means there's got to be a goal, which means what's the intervention, right? So there's got to be one care plan. We had one care plan here, and that was up here when we talked about, right, what the issue was. Let me go back to the beginning, right? We had a family adaptation issue. The daughter was having trouble coping, right? She was a little overwhelmed because didn't expect him to be passing as quickly as it was happening, right? So we have an issue, and then we have a goal, and then we have an intervention. So there's one care plan. You can have more than one care plan. Sometimes you'll go into a situation where there are a lot of issues. Sometimes you'll go into a situation where there aren't any issues, and then you won't do any further visits, right? Every case is unique. So, and if you have any questions about it, you can always yell, okay? So I hope that helps, at least with the basics. I'm going to do another video on different care plans for chaplains. That's coming up next. So see you soon. And bye.